realized, I truly apologize, I forgot to record the meeting, so I'll have to give you guys written minutes for the first two items. Now the meeting is recorded. I'll give you guys written minutes about the bylaws and calendar year contracts. Okay, third item is the partnership with Heidelberg and Firelands. I did mention this to you guys in the last 2 months. We had numerous discussions with Heidelberg and Firelands regarding recruiting and retaining master level licensed therapists to work in our board district and to work in community mental health. I want to make sure that those are key elements. Again, we had various meetings with both parties already. Both parties agree on terms. We have a draft contract going back and forth among the three of us. We are planning. Everybody understands that the board cannot commit them more than 1 year at a time, but the goal is for this to be a 5-year project. They will try to go go 2 ways at the same time. One, it's creating a scholarship with Heidelberg beginning school year 2021-2022, where together we can try to identify those potential students. They go through a process on how to apply for the scholarship, and from there on they can enter this project. As well as we are working with Firelands for a loan reimbursement program for students that maybe are now halfway through their master or at the end of their master right now, and most of them are already being linked with Firelands for field work or work experience or internship. So that's another area we are working on. We are trying to make sure we identify people that represent our communities. What I mean by that, we're going to put an emphasis, especially in Fremont and Sandusky County, to make sure that some of these potential workers represent minority community in Fremont and Sandusky County. Make sure I'm not missing anything. I think I highlighted. Oh, probably this is what I wanted to mention. That was really important. This should be, some of you guys should be really happy. I think we are working and planning to call this as the Phyllis Putnam Mental Health Scholarship Program in relation to Heidelberg. So this for some of you guys that have been around where she served on the board, I think I was really happy, and actually this was Robin's idea. And if you guys knew Leon, he was a professor at Heidelberg University for many years. So I think Heidelberg is also very excited. We are very excited, so we're gonna probably try to call this as the Phyllis Putnam Scholarship. So any questions? Robin, you want to add anything? You are muted, but I think you shake no. All right, I think Robin doesn't want to say anything. We're going to move on. Also, we discussed services in Fostoria, crisis services in Fostoria. If you guys recall, around 2-3 months ago, starting November 1st, Firelands Counseling and Recovery Services is no longer providing crisis services at the Fostoria ER. I heard the message very clear from you guys back then, and the message was make sure we still take care of our residents. Doesn't matter if the crisis happening at the Fostoria Hospital, which is in Hancock County. So again, I heard your message very clear. I think it was Jimmy and Kelly who really wanted those things. So we also wanted that. I engaged in many conversations with ProMedica, including the Flower Hospital in Lucas County, and we agreed on terms for mental health inpatient services, if needed, for Seneca, Sandusky, and Wyandotte County clients, and most likely they will be sent the Flower Hospital in Lucas County. But we agree on terms regarding the inpatient services and the transportation. This doesn't include the cost of the crisis assessment itself. $40,000 is just a projected amount. Usually I try to project a little high so I don't have to come back to you guys every 4 or 5 months. But obviously if that amount, if the service is going to exceed that amount, I'll have to come back to you guys. All this will depend on how many people will be in a crisis and need hospitalization and a bed is available. So the contract will go back November 1st and will go through June 30th of 2021. I told them that I really want to get on a stay fiscal year period. So I think they wanted a longer contract. I told them I just want it through June 30th. I want you guys to know the inpatient rate for an indigent client per day, it will be $800. Which is it's the marketable price, I guess. It's very much in line with Arrowhead and Rescue. Actually, many areas we were able to reduce our cost. We used to have a one-time cost fee at Rescue, I believe $1,250 per client sent to Rescue. So right now our rates for Arrowhead is $750 a day, and for ProMedica $800 a day.
So it's comparable.
Yes. Any questions? Okay. If you can unmute yourself but you still have a question, just raise your hand so I don't. Yeah, Pamela, I think, has a question.
I can unmute.
You are. Yeah, go ahead now, Pamela.
I said I wondered if Medicaid would be a part of this, especially for indigent people. You know, rather than the $400 or $800 or whatever. They, I'm sure, are up to snuff with Medicaid. ProMedica is. So I was just wondering, why bill us when they could bill Medicaid first?
Correct. So they are obligating under our contract terms to bill Medicaid for everybody who's Medicaid eligible. So let's assume they are serving, or they are hospitalizing, I guess, 20 Seneca County residents in the next 6 months. We might be covering 3 or 4 out of those 20, and 16 and 17 out of them will be covered by Medicaid. So that is correct. We will not utilize these funds for Medicaid eligible clients. So correct, ProMedica is already billing Medicaid for those clients, yes. And I want you guys to know this is really our standard with all the agencies we contract for treatment services. So Arrowhead, the same thing. Farlands, the same thing. What we call indigent clients, I'll just give you guys an example. Let's just say client A goes to Farlands and they have just regular insurance. It might not be the best insurance, but they have some sort of insurance. Might be a single mom with 2 children. Farlands will first bill this person insurance. Then whatever the insurance doesn't cover, based on her monthly income, then we will apply what we call a sliding fee schedule, which then means that based on her monthly or annual income, we as a board, we might cover 75% of the remaining balance, and she might have to cover 25% of that balance, okay? In some rare cases, we sometimes make exceptions. In the past, we had clients that had extremely high deductibles that they were refusing treatments because, yes, I have insurance, but I have $6,000 out of pocket. So for those, sometimes, again, we try to apply some sort of sliding fee schedule formula and assist them so they don't drop out of treatment. Any questions?
For those with inadequate insurance, I guess is the word, right?
Yes, so Jimmy corrected me. He's correct. For those with inadequate insurance, yes. But again, for Medicaid clients, Farlands or all the other providers will bill Medicaid. Now you also got to keep in mind that some services, you might have a Medicaid client, but some of the services are not Medicaid reimbursable. So it kind of all depends. It depends on the service the person receives, yes. Any questions? Robin, anything you want to add? Okay, we're moving on. Sandusky County reentry. This is an update. Sandusky County reentry has been providing reentry services both in Seneca County and Sandusky County. They started in Seneca County around 3 years ago, and they were coming to the county jail 2 to 3 times per week to engage with people with behavioral health and try to link them with services on the outside, housing, driver license, GED, you name it. Well, since the beginning of this pandemic, they were not considered essential service in the county jail. Therefore, since beginning of March or so, they haven't provided these reentry services in Seneca County. Their director, reentry director, has informed me in writing that they would like to withdraw and terminate the contract with the board due to their inability to continue the services at the Seneca County jail. This is the contract for fiscal year 2021. It's an amount of $30,000, and obviously they haven't billed anything in the contract, and they wanted to inform me that they would like to terminate the contract, as well as asking us to invest the fund, I guess, in other behavioral health services in Seneca County.
What about Sandusky County?
They are continuing the services in Sandusky County as they have a different model. They are linking with people released from jail outside of the jail settings. They are not going in the jail. They just have different arrangements in Sandusky County. Yes, Pamela.
What are we talking as far as numbers? Are we hurting 50 guys or women, or are we hurting 10? Are we, what is their numbers that they've been serving and now they're not going to?
If you probably give us 60 seconds, Robin can probably pull those numbers out of approximately how much they used to serve previous year. So
I have a question about that too, Mircea.
Yeah.
I know it was their decision. Is the decision just because of the pandemic situation? Is it something that they will reinstitute once things settle down? And I guess part 2 of that is whoever was providing those services, they couldn't do that virtually?
2 questions. So I want to make sure I respond to one at a time. I think some of the decision had to do with changes in the sheriffs in Seneca County, in my opinion. As you guys know, Seneca County will have a new sheriff beginning January 1st. This program was really brought in by the current sheriff. So I'm not sure, could be some relationship things. I also know that the reentry program might not as a whole continue even in Sandusky County in the near future. I know that program, as I say, in Sandusky County was more run through the courts and in partnership with the judges. Services were provided outside of the jail settings, but as you know, we had some changes there with the judges, I think, and didn't help me here. I think it started under Judge, what was her name? She passed away 2-3 years ago. She had cancer. Before Bob Hart was appointed.
Anstead.
Thank you, Marcus. Yes. So I think Judge Anstead was a champion of this program, and I think since then it's kind of slowly going the opposite direction with the changes that happen in Sandusky County. So, Linda, back to your second question. I'm not sure if they are planning to return back, even if the pandemic will to end anytime soon. I think it's more than just the pandemic, but kind of this was the start. Yes. Robin?
And just to go back to the question about the numbers, just scanning the reports, it looks like on average around 75 per year. Now, last year was an exception. They had 37 in the first half and then 12 in the second half, but that was because of COVID and their limited ability to go out to the jail.
Now, what I put here on agenda is right now who is going at the jail to provide services and linkage is Farlands Counseling and Recovery. They are going daily, as well as Rigel Recovery Services through the PV Drug Court. So those two behavioral health services are continuing. This was more drug related. We could approve the funds and create almost a model like reentry for the PV drug court for those participants, and then try to work with the courts to develop a similar product, I guess, beginning the first of the year once the new sheriff is in place. I think it's too late now to try to implement something with the current sheriff, and they have to change everything January 1st. So we'll probably wait until the first of the year to meet with the new sheriff and the judges, and maybe try to create a different model re-entry through the pivot court in Seneca County at the local jail. But that would probably the only alternative for these funds, and I wanted to bring it up to you. I want to make it clear the current sheriff is very supportive of these services and the PV drug court. I'm not saying that. I'm just saying you might have to change your terms significantly once the new sheriff takes office. So this time might as well wait until the first of the year. Go ahead, Pamela.
Yeah.
We can hear you. No, we can't. Try to unmute yourself again.
I was just wondering if there were enough numbers to try to fight it. Seems like they just dropped us, but there's other things. But is it something that we would like to fight or not?
Well, right now, the current sheriff considered them as non-essential, so told them you can enter the jail while this pandemic is going on. So even if let's assume we fight it and we tell them, no, tomorrow you got to start going back, the sheriff is not allowing them to go back. So they can enter the facility to provide the same services.
Okay.
Pamela, I do think what tends to happen in a situation like this is the therapist is out at the jail. And so a lot of times if there's not any natural support to assist them, then the therapist steps in and tries to assist where a case manager or a reentry person would normally assist.
So they have somebody, right?
Correct.
Okay.
Now, I guess the question is regarding this item on agenda is, shall we try to develop a new partnership to cover similar services after the first of the year through June 30th, and then see what options we have next fiscal year? Or are we not to seek any other options until June 30th? And I think that if you want to seek some sort of replacement now, probably the only comparable service in Seneca County will be to link with the PV drug recovery docket.
I was just remembering I was just remembering that girl that came to us, and she was in there and I thought she was excellent. So I just, it just seemed like such a good service. So
And
that was where my thought came from.
and the reason I said pivot is that those workers from Rigel can get in the jail because they are part of the previc drug recovery docket and they consider that essential. So they still go to the jail to see these clients. But Pamela, I know exactly what you're talking about. I believe the lady that came and presented at our board meeting, and there was
Yeah.
actually us, Stephanie Smith, who went in, interview her, and link her with Lotus Recovery House. Yes.
Yeah.
Another thing to keep in mind, one of the things we hope to do in the coming months is sequential mapping of mental health services out at the jail, and that would hopefully give us an idea of any gaps and needs, and that might help us get a better understanding of what's needed in regards to reentry or case management services out there.
Any other comments?
I just think we need to provide some kind of services before June.
So if I understood Kelly correctly, and Kelly just nod your head, is that Kelly believes that we should try to go ahead and implement something prior to June 30th and not just wait until the end of the fiscal year.
And that's what I was going to say too. If we're looking at this sequential mapping to see where our gaps are and everything else, should we do that before we would proceed to try to implement something? I mean, that makes sense to figure out what we need before we start forward.
I think that's a very good plan, Celinda. The probably one thing we can promise is we know the goal is for this to happen early next year, but we don't know when will happen. The facilitators of this very important exercise will want commitment from a lot of county leaders, a 2-day commitment to conduct this exercise. And it depends of those county leaders committing to participating for us to be able to complete it.
Gotcha.
But we can hold on approving this if that's the direction you guys want to go. And I know starting January we are planning to schedule that, but again, just because we're going to work on scheduling it, unless county leaders, if they don't commit to this, it might be after June 30th that this even happens. Robin, do you have any idea, talking with the state about sequential mapping?
Sequential mapping?
Yes.
I haven't asked recently. I can do that and get a feel for when they might be able to do that. But when I last spoke to them maybe a year ago, they were eager to make it happen at any point.
As I said, is also a change in the sheriff, and I know I met with the incoming sheriff a few times one-on-one, and he's very pro, I would say, mental health and addictions and what we as board are trying to implement in Seneca County. But I know that he wants to go in there and try to find out himself what might need change before he gonna even come forward with any recommendation. So he will probably need a few months before he can say, hey, I want to do this different. All right. So we're hanging on to this. Don't make a decision. Wait and try to update you guys after the first of the year. Is that correct? Dean, Pat. All right. That's what we're gonna do. So we're gonna table 5A. We're gonna move to Open Door Resource Center from Wyandotte County. Robin?
So Open Door Resource Center is a Wyandotte County faith-based organization that the board has been contracting with in more recent years for them to provide the Bridges Out of Poverty training. Their current contract is $10,000. And what they usually do is they hold 2 to 3 series of the Bridges Out of Poverty training sessions, and they last several weeks. However, with COVID, they haven't been able to do one yet this fiscal year. But also due to COVID, they've had an increase in persons with mental health or substance use that are presenting in crisis for basic needs, rent, transportation, food. And so per their contract, they put in writing a request to MIRCHA to revise their contract that would allow them to use the funds that they were not using for the Bridges Out of Poverty training to use towards meeting these basic needs for these individuals. It does not result in any changing in funding. It's just a matter of changing the language for their contract.
This is more like an update, but I wanted to put it out there because, again, we have a few newer board members. When it's just some contract language change and doesn't necessarily require dollar amount change, sometimes we approve that, or I will approve that without a formal motion, but I just wanted to give you guys a heads up. Robin, you want to go about number 7?
Sure. This is just an update on the 3 grants that I talked about last month, and I'll try to keep this as simple as I can for now. The MAT, or Medication Assisted Treatment Grant, was the 3-year grant that came to an end at the end of September. We were eligible to apply to utilize any of our unspent funds from year 3 to cover efforts to gather data. So it wasn't going to be to provide for new treatment expenses. It was just to collect the ongoing data. And we decided with Firelands that we were not in a position to get the expected outcomes that OMAS wanted within the 60-day turnaround that we learned of at the beginning of November. So we opted out of applying for those funds. We did apply for the SOAR 1.0 no-cost extension, and those were the 60-day funds to help us get from SOAR 1.0 over to SOAR 2.0, which begins in December. And we were approved for the Lotus Recovery House to receive $12,774.48. And then these funds would cover the expenses until SOAR 2.0 can be approved for the Lotus House starting in December. We're currently in the process of reviewing applications that we received from local agencies to include in our SOAR 2.0 application, which is due this Friday. We had a range of applications for prevention, treatment, and recovery supports in SSW. We plan to have the board's plan submitted by Friday, and then we hope to have approval from OMAS before our next board meeting in December. They're promising a very quick turnaround on review of the applications and approvals to the board. So then we'll bring any action items to the board at our December meeting.
I just want to highlight what Robin just said in her last few sentences. We are planning to send the application by this Friday. And if best case scenario, we get a response by the state prior to December 3rd at 4:30 p.m. And if we do, we're going to put that on the agenda as all business, because we already discussed it today, to get those contracts approved. If we miss that December 3rd deadline, we'll have to wait until end of January to approve these contracts, and this grant beginning start date was October 1st. So we are already behind 3 months. We can be behind 4 or 5 months in approval of the contract. So I just want everybody to know, I believe total application among 5-6 different agencies it's approximately $310,000. Is that correct? Around there somewhere.
We received 2 more, plus we have Lotus, and actually, with all of those, we're closer to 500,000 at this point, without, making any adjustments or decisions.
Any questions? So again, will be close to $500,000 application. As Robin said, agencies from all 3 counties applied, all kinds of services. So these are fairer funds though, so the contracts will be a little bit stricter and lengthier, and obviously the state will also have to approve it. So hopefully it will happen before December 3rd. So again, we'll bring this during our all business discussion. If we find out sooner than expected, I might just include it in my letter or in a memo to you guys prior to the meeting. Any questions? Okay, moving on to fun stuff. I sent you guys the temporary budget. Admin costs remain flat to what we currently have this year. A few things that I wanted to highlight in a calendar year budget. On the front page, which is this, there were a few items that were highlighted in blue. So I want everybody to know we received those funds in calendar year 2020. We asked the state for carryover. Those funds will be expended in calendar year 2021. We will not going to receive them again in 2021. So what I'm saying is we received the money in 2020, we're going to expend them in 2021. Therefore, the 2021 calendar going to show higher expenses than revenue. So for the newer board members, we work with the State Department on a state fiscal year budget. We work on some of these federal grants on a federal fiscal year, and with the county auditor, we work on a calendar year, which this is what it is. And this is overlapping 2 other fiscal years that we work with. So it could be a little confusing. Since I've been with the board for 9 years now, we never had revenues higher than expenses. We always had expenses higher than revenue, but we always balance it. There wasn't a year that we didn't balance it. So there hasn't been a year that we didn't come with a plus. But every time we did the budget, it looks as a negative amount. So I just wanted to highlight that. Those 4 were the CTP carryover funds. That's for individuals released from the prison system. ATP for Seneca and Sandusky, those are for drug courts. And then the K-12 prevention services for the local schools. All those 4 items together were around, I believe, $400,000, between $400,000 and $500,000 that we already received, but we're going to spend them in calendar year 2021. So we have to add it to the budget as an expense, but as you can see as a revenue, that's a 0 revenue. Questions about anything on the budget? Keep in mind that some are very rough projections. This budget should include the state fiscal year 22 budget, which is beginning July 1 of next year. Obviously, we're projecting a lot of those things. And keep in mind that we are also going to approve a temporary budget at the January board meeting. So this document in front of you is going to be modified even more by the end of January, and then reapprove it again, I guess. And the other 2 things that I sent yesterday was a resolution to adjust our estimated resources, and I can explain what that means. And a resolution to adjust our SAP app is what we call it. So estimated resources means, in a very simple words, if we are expecting to receive $1 million in fund 100, this is just an example, but we didn't receive $1 million. We received $1.2 million in that fund account. We're gonna adjust it and increase our expected revenues by $200,000. So we try to balance our budget with actuals to the penny by the end of the calendar year. So if it's a fund account, they will project it to receive $10,000 and we receive only $9,000, then we reduce our expected revenues by $1,000, again, try to balance it to zero. Just a formality we gotta do with the county auditor's office every year. SOP app, really, same thing, and probably the best example I can give you here is Sandusky County Task. We have with Sandusky County Task right now on a purchase order. So one means the funds were approved and are sitting on a purchase order, approximately $119,000 for calendar year 2020. So those funds gotta be spent by December 31st. Well, I just talked with Sandusky County Task and they have requested the state to reimburse us around $84,000 just this week. So we are planning to get $84,000 by the end of the year and pay them $84,000. So therefore, as I say, we have 119 encumbered. We're gonna reduce that encumbered purchase order from 119 to 84 to make sure we balance everything to zero as expenditure. So we try to also match everything and make sure we are balanced by December 31st. If you have any questions financially related, please ask. Go ahead, Pamela.
Okay, I'm having difficulty with the muting. I was just wondering, the money that we set aside for schools, for counseling in schools, for the different, I'm thinking of Columbia and, the different monies we've set aside. The kids aren't in school. Most, I don't know where, they're homeschooled. What about that money?
That is, so there are two parts of funding we give to schools. One comes from local levy funds. Okay.
Yeah.
And that's a formula. And the other one is this K-12 prevention that I actually mentioned earlier in the budget. So for example, the K-12 preventions, because the state of Ohio realized that most of the schools are going hybrid and they might not be able to implement the prevention services they wanted, they approve a 1-year carryover. So they're telling us, hey, you don't have to give the money to the schools now, you can keep them and the schools can use it into the next school year. So they're pretty much extending the period we can expend the money. They are not giving us additional funds, they're just saying, keep the money and use it the next school year if you can implement the services. With the local levy funds, we were just a little bit more flexible when it comes to services. So some of the schools, the money go to the schools. So our philosophy was we're going to work with the local school administrators and what they believe their need is in behavioral health, we'll make the adjustments. So some of the schools are providing some sort of telehealth to some of the students. Some schools are already. Some of them continue to go in person. I can think of Seneca East. We are talking with that therapist every week and she is seeing students face to face every week at Seneca East. Some schools go hybrid and they might want to utilize the funds in a different way. So I guess we take each school separate when we work on their plan for levy funds. And we're going to be flexible as well. I won't be surprised if some school's going to come to us and say, hey, your board approved $30,000. There's no way I can spend it on needy now because we are all hybrid, but can I use half of it into the next school year? So that could happen. They might come to us to extend our contract period.
Yeah, I was just wondering how it, hit the budget, whatever.
Yeah, I mean, the funds are committed to the schools till the end of the school year. So what will happen after January, we don't know, I guess, yet with COVID. So we'll probably have to make a lot of adjustments to the school contracts in the spring sometimes.
Okay.
Any questions? Those two resolutions, I can almost guarantee you something might change from now until December 3rd. So take them as drafts, especially that this is the one time a year where between the committee meetings and the board meeting we have 2 weeks difference and not 1 week due to Thanksgiving. All right, I'm gonna move on to some old business. The reason I wrote is old business because we discussed about it to approve it. I wanted to delay it to make sure the funds are there. We were expecting actually a $2,000 increase, which we received, but we are ready to approve the contract with Prevention Connections. This is for the SPF grant through the Sandusky County Health Department. The board is getting a total of $40,000. We are taking $8,000 out of those 40 and give it to Prevention Connections LLC for services specific to Seneca County. I actually think we already had this on agenda, but then in the last minute I took it off a motion. Wanted to make sure the total contract used to be $38,000, but now the contract is $40,000, so they actually increased our contract amount by $2,000. Any questions?
Is it Seneca County or Sandusky?
These are for services in Seneca County. The funds come from the Sandusky County Health Department. This is a 4-county federal grant, includes Seneca, Sandusky, Wyandotte, and Huron. But the money goes from the feds to the Sandusky County Health Department, from the Sandusky County Health Department to us, and from us to Prevention Connections. The same funds go from the feds to the Sandusky County Health Department, from the Sandusky County Health Department to Wyandotte County FCFC. We are not being their fiscal agent, the money goes directly to them. So the reason I'm saying that all 3 counties benefit and receive the same services regarding this federal grant. We are just the fiscal agent only of Prevention Connections. Sandusky and Wyandotte get these funds as well. All right, let's move to 11C first. What did you guys think about ethics training? Thoughts, comments?
Interesting. Well, it kept your attention.
He's very good. Very good.
Yeah, I thought so too.
Yeah, I thought he did a great job.
I enjoyed it.
Excellent.
Well, honestly, go ahead.
I just know that I'm going to have to watch Robin around me sometimes.
I would like to make a comment about that. This is Polly. I thought it was very good, and I think it's appropriate for us to be in service on this from time to time, because the pressures from the community could be very great on any one of the staff or any one of the board members. So thanks for bringing that.
Thank you, Polly. No, I think it's really refreshing. We try to do ethics at least every other year. But I think one thing that might be maybe very related to us as well, maybe we'll bring him next year to do ethics regarding budgeting and approving contracts. I've seen some of his sessions already, and he's pretty good when you have to make some really tough decisions between 2 agencies and who you fund and who you don't fund. And really, regardless what decision you make, somebody gonna get hurt. So maybe we'll bring him again next year. One thing I do want to highlight is he doesn't like his trainings to be out to the public, obviously, because I think that's how he's making a living. But we do have the training recorded for us only. So especially I would say especially the last 20 minutes, half an hour, were more directly related to us. So if you guys ever want to see that last 20-30 minute clip, I'm going to work with Rose from our office to make a clip. And I'm thinking that especially upcoming board members in the future, they might want to go through that, at least review the clip prior to committing being on our board. So just keep that in mind. If you want to re-see it again or listen to it, we have it available. And I also have available the PowerPoint, which I will email you that with the board mailing. And expect the board mailing to probably come Wednesday before Thanksgiving. Usually I send it Friday, but we don't have a meeting next week. Okay.
Thank you. I was going to ask you about that PowerPoint because it was, I mean, he made it nice to see, but it'd be nice to kind of go through it on our own.
Yep, perfect. We'll make that available. And as I said, I'll try to make a routine to share some ethics information with you guys. I receive quarterly updates from the Ohio Ethics Commission about things that are happening across the state. If I find some things that are interesting and pertain to us, I'll make sure to share them with you guys. If you guys recall, around 4 months ago, I shared with you guys some Ohio ethics opinions about some things that I found interesting that related again to the board. So we'll always try our best to keep you guys up to speed regarding ethics. The next item I want to talk about is emergency policy process, and I just want to discuss this a little bit. Again, we do have some newer board members, so I want to make sure that everybody we do a little education here, and we always try to better the way we do things. A little history: around 2.5 years ago, Lorain County Mental Health Board executive director received the state audit, and he was I guess he received the finding due to the fact that he approved some payments for emergency services without board approval. So his board was approving on a calendar year budget a purchase order for emergency services. They was approving a budget. He was using that and issuing payments for emergency services. So let me give you an example what those can mean. Can mean that I get a phone call right now about somebody maybe in an ER in need of detox services, and everybody is scrambling to look for a bed. And let's just say I call Arrowhead, and Arrowhead say, hey, I can take him at 8 p.m. tonight, but for me to hold the bed, I'm gonna send you this fax, you gotta sign it, and you gotta commit $750 a day for the next 5 days, correct? Well, if that's the case, for us to hold the bed, I can't wait until the next board meeting. I mean, it's just forget about it. So what happened, Lorain County Executive Director, which was a year from retirement, went to the Ohio legislator and said, this is BS. I want to introduce a law to make this very clear that we can do this. So he introduced a law, and the law passed, and the law is saying that a board can authorize its executive director to execute both of the following type of contracts valued at $25,000 or less. And he's talking about emergency contracts for clinical services, as well as standard service contract pertaining to the board's operations. And really what that means is, let's assume again tomorrow we're gonna have high winds in Seneca County, 40, 50 miles an hour winds. And let's assume that 3 windows just blow off our office building. If you don't have this in place, I gotta wait until December 3rd to bring something for you guys for approval for me to be able to replace those 3 windows. This policy is allowing me, hey, go ahead and replace those 3 windows because it's an emergency and this needs to get done. So when the law passed, obviously we as a board, because we didn't want to run into the same issues, we actually had very similar operations as the Lorain County Board. We didn't have any fiscal audit, but they did. So we implemented a very similar policy that really follows the Ohio law. And it's pretty much saying exactly what I told you guys. If it's an emergency contract regarding clients or regarding board of operations, I have up to $25,000. I can go ahead and do that without board approval. I mean, I want you guys to know when it means board approval, you guys already approve it in this budget. If it's not here, I can encumber it. So it's already here. You guys gonna do a motion for the budget, okay? But it's not specific necessarily to that agency or to that client. So I don't have a motion saying $7,000 for Arrowhead Behavior Health. I don't have that because when it's an emergency, I'm gonna send the client anywhere in the state of Ohio I can find a bed. I mean, he can go anywhere in the state of Ohio, correct? So it's more like a blanket purchase order. So just to clean up a little bit, we discussed about this more in the last few months with Tanya and Robin. This is what we are going to do, just to try to smooth it and make it as clean as possible. If it's an emergency payment that we approve in between board meetings, we will highlight it in red on the board expenditure report that you're going to receive every month. So the board expenditure report that you receive with board mailing, if you see something that's in red, that means there was an emergency payment. Okay, I can highlight those if you want me to at the board, every board meeting. If you want me to also say it and you hear it, I can. If you're gonna review the expenditure report, it will be highlighted in red. So every month, everything that's highlighted in red was an emergency service. If it's how do I say it? It's still a critical service, but it's not so urgent, and we can wait 2-3 weeks until the board meeting, I will always bring it in front of you. So, and that example gonna come here later on agenda. We have 2 adolescents that receive some critical services at one agency in Finley, and we want to make sure we keep them in that treatment. Now, we are working with the agency because we have a relationship, and they are telling me, well, you don't have to make the commitment tonight. And I tell him, okay, well, can you wait until after December 3rd? And if the agency say, yeah, I can wait, then I'll always bring those in front of you for pre-approval. Does it make sense? Another example will be for the office building. Let's say we look at the office and we say, oh my God, we really need a new roof. I mean, this roof gonna leak here soon, we need a new roof. Well, if I'm planning roof changes for June or July next year, I'm gonna always bring it to you first for approval because I have enough time to plan it. So if I have 2-3 weeks, 4 weeks to plan it, I will try to delay approving any emergency services. But I want you guys to know we always try to put the client first. I don't want a client to be kicked out of a service because now I gotta wait until December 3rd. When we have the policy in place, approve, and we have the budget already in place, approve. Does it make sense? Any questions? Okay. And with that, I will turn to the last item to Robin, which is actually a little bit related to what I just talked. Go ahead, Robin.
So, as Mircea mentioned, we have 2 cases involving adolescents who received DBT treatment. That stands for dialectical behavior therapy, and they received the services through a Renewed Mind in Finley. This is a 6-month therapy program that's designed to help persons in need of intensive or, like Mircea said, critical services to learn new ways of coping, managing their emotions, and relationships with others. These are individuals who often are managed in and out of the crisis system. And so in an attempt to stabilize these youth and to avoid hospitalization, because we know we have a shortage on inpatient beds, a Renewed Mind provided the service and are asking the board if we could assist with covering the services beyond what the family and their insurance could cover. They're asking for funding to cover Seneca County youth from July 1st through October 21st in the amount of $1,981.14, and for funding to cover Wyandotte County youth from July 1st through November 11th in the amount of $2,122.65. Now with the Seneca County one, we may not have the full amount that they're asking for. We have 2 other invoices that are expected to come in, and we might not be able to pay that full amount, so it would be up to what's available on that purchase order after we make the other 2 payments. But we're asking the board to allow us to enter into an agreement with a Renewed Mind for payment up to the funds available for the DBT services for these 2 youth. Now, I did talk to them about in the future, letting us know up front that they have some cases. And what they were trying to do is they were trying to appeal insurance and get a real feel for what insurance in the family was going to be able to cover before they approached us. But we've asked that our preference is they let us know initially that they even have the potential case. Now, this is an agency that we do not have any contract currently for the sliding fee scale.
Hey, Robin, how long have you been in discussions with them about these 2 youth?
I want to say since early October.
And is a high probability that service is going to continue maybe even into the next calendar year for these two youth, correct?
Correct. What happens with DBT is it's roughly a 6-month treatment program, and then there's an additional 6 months that they can take after they complete the first series. What they're trying to do is manage them on other outpatient services, but of course, if they go back into the crisis system, they may want to try to put them back into another 6 months. That's the optional programming, the second 6 months.
It's like follow-up.
Any questions for Robin? Again, this wasn't necessarily a crisis emergency that we had to commit right then the funds, but it's still a critical service. So again, that's how we're going to operate. If it's something that can wait until the committee meeting and the board meeting, always bring it in front of you guys. Usually the emergencies are, most of them are either somebody in need of detox right now, whatever, it's alcohol detox or opiate detox or whatever, as well as mental health inpatient beds. Those can be, especially for children, those can be high emergencies. So those usually we have to look for a placement right then and there and commit the funds right then. So we'll highlight those. We don't have many, too many, I guess, in 1 year, but we'll highlight them in every expenditure report. Unless, again, if you want me to give you a verbal update, I can. It's up to you guys.
It's Polly again. Sorry to take up so much time. I'm when it comes to youth, and we're seeing all of the various mental health issues on the rise with our young people, I just want to applaud you for looking at this and making decisions about it. To get our young people into treatment and to maintain them in treatment and to help them, isn't that part of our role?
Polly is very much part of our role, yes. And it's actually, I call it one of our priorities. If you look at the strategic plan, we work for almost 18 months. Mental health services for youth is one of the top priorities we are really pushing. If you guys look at how much local levy funds, I'm not talking about state funds, but local levy funds we are investing in through children, through the schools. This year, and unfortunately we hit a pandemic, but this fiscal year is the most funds we ever invested as a board into services for youth. So I want to make sure you guys know that. So as Dr. Gillette said, when one want to look about what your priorities are, they just got to look at your budget. So if you look at our budget, you can see that our most investment is into children at the current time.
I'll add to that too, that today I participated in the OMAS hosted Crisis Academy, and the focus today was on children in crisis services. And I think it was Children's Hospital talked about the bed shortage and how they're not even accepting people outside of the Cincinnati area because of the bed shortage. And so everyone was really encouraged to consider being creative and trying to figure out, because there's a bed shortage, just how can you manage these adolescents and children in our community with other outpatient services when inpatient services are not available.
Correct. In addition to that, I also want to just mention this, just in the last 18 months, we entered into this collaborative project with the Children's Services in all 3 counties. Now we are in a process of trying to develop treatment foster homes, which we have 0 at the current time in the 3 counties. We also have entered into a contract with UTMC just in the last 18 months for inpatient services related to youth. So we understand the need. Actually, the newspaper want to do an article tomorrow about this with us, but we truly understand the need. Now the question is how can we get to the children and the families in need in the middle of this pandemic? And I don't know if I update you guys on this, but we had a meeting with the Educational Service Center and the Juvenile Court, where unfortunately they are telling us that they experience children who are being exposed and asked to self-quarantine for a period of 2 weeks, that are in first and second grade, that are left home by themselves because the parents are going to work. And these are children very, very young. So now the Educational Service Center is involved. Some of the cases, Juvenile Court is involved. And, you know, just the other day I was talking with Jimmy Young. As you guys know, Jimmy has a long history assisting or working with children's services in Seneca County. And if you look at children's services reports regarding abuse and neglect, it's a huge reduction since the pandemic, which is interesting, but not really, because they know that maybe the neglect and abuse is still happening, but there's nobody to report it. You know, these children are home just with their parents. Usually the people who report these kind of things are coaches or teachers or school staff. And now many students are learning from home, hybrid, I guess, instead of in person. So we are really, as Robin mentioned, we really need to be creative. How can we get to these children and families now, especially in the middle of the pandemic? Any questions or thoughts? I guess we're at the bottom of the agenda. It will be our last board meeting of the year, December. Kind of feel bad a little bit that we have 2 new board members, Polly and Charity, and we never had the chance to meet them in person. Not I, but you guys as a group. But hopefully, by the end of the fiscal year, which is June 30th, we can resume in person. As I mentioned, that's a bill on the floor, ready to be approved to extend virtual meetings beyond December 1st. I hope that will happen. If not, we won't be able to legally have the meeting December 3rd. But I'm pretty sure it will happen. January, we are going to have a presentation at the end of our board meeting from Sure Respect Recovery Center. They run 2 detox centers in Fremont and Bloomville. They have new management by Louis and David Guardiola. Some of you guys know them from the Fremont Sandusky County community. Some of you guys know them. I believe Louis served on this board way before my time. So they will do a presentation at the end of January for us. Do you guys have any questions? I do have one more update. As you guys know, I was selected with 4 other executive directors to be part of a was called a negotiation team. Now they give a different name. I don't even know what they call it anymore. But we have 2 more meetings with 5 CEOs from different providers across the state. As I said, there were some difference in opinions between some practices between the boards and providers, and there are a few lawsuits out there. Some are being settled now. But really probably the most sticking point that you should know is this. Now again, I'll try to be very simplistic about it. Ohio Revised Code is mandating the boards to give, and this is in a very simplistic way, but follow me here, to give a 120-day notice to any provider prior to termination of the contract. And then once you give that 120-day, you gotta have at least 60 of those days. You gotta enter, I believe it's called, into discussion negotiation that are gotta go kind of both ways between both the board and the provider. And if after 60 days you don't come into the agreement, then you gotta report to the State Department, and they're gonna come in as a mediator and try to figure out what will happen. So, having this discussion with attorneys, and again, this is really the sticking point of the lawsuits, is, some of the boards, like even us, my argument was, hey, I'm giving everybody 120-day notice, because 120 day will mean March 1st, correct? So March, April, May, June. So March 1st, I got to give everybody 120-day notice, because I don't know my state budget March 1st. I can't tell Fallens, hey, you're going to get $2 million next year. I can't commit to the same amount. I don't know what my state budget going to be, or what my federal grant going to be. So kind of liability, I'm giving everybody 120 days. Say, hey, I don't know if we're going to enter into a contract with you. I don't know if we're going to have the same amount of funding. Some priorities might change. My board is in the middle of a strategic plan. The need might change. We're in the middle of the community health improvement plan. Now, some providers don't like that, because they want us to be a little bit more specific. There are very, very few boards, only a few, that don't really give 120-day notice out unless they know 100% they're going to make a significant change to the contract. So kind of really, this is the big sticking point. But what if you don't give a 120-day notice? Let's say your contract, which all of our state contract end June 30th. Really, the contract end day period doesn't mean anything. We are still committed for another 120 days after June 30th. So let's say that, I guess worst case scenario can happen, that we don't want to work with Farlands anymore. Farlands is going to say, you still got to give me 120-day funding after the end of the contract period. And that section of Ohio Revised Code is what's very confusing, and half of the attorneys believe it one way, half of the attorneys believe it a different way. And I think when it was introduced many years ago, was more to protect the clients. The clients, if you terminate a contract to an agency, let's say like Farlands or Oriana House, where those clients gonna go? So then the legislators say, board, you are responsible for another 120 day. You gotta give them another 120 day of funding, so they have time to transfer those clients somewhere else or to close those cases. So that's probably the best reason I think that part of law was introduced. But us as boards, I'm not sure how other public entities work. We have this revision in Ohio Revised Code. We got to give everybody a 120-day notice if you want to terminate their contract. Now, there's also argument about what about terminate the contract, just 30-day termination. And that's also in the contract, clause termination. And that could happen. Let's say somebody like Farlands loses their license. Well, then the interpretation is you don't have to give them 120 days. You just got to give them 30-day notice, So we have both the 120-day and the 30-day termination in our contracts. And it is just kind of confusing language right now. And that's why some of the boards and providers are now in the court system and have judges make the decision. As I said, there are a few attorneys that specialize in behavioral health. They have very different opinion. And that's really why at the beginning of the agenda I said, can I have some flexibility on maybe who we use? The reality is that the boards that are being sued are using Christina language and interpretation of 120 day. And I'm not sure if that's what it should be. But it's something that we discussed the other day, part of this negotiation team, for around 2 hours, and it almost ended up not well. But we have another meeting to discuss this. But I just wanted to let you know it's not like any other standard contract. We as boards have different clauses in Ohio Revised Code that now we're trying to navigate and make sure we follow the law. But as I said, different attorneys have different interpretation.
So that's not breaking a contract if you have to wait till the end of the contract. It's not.
No,
And
so
you just go without renewing the contract, and so you don't have to give them 120 days for not renewing a contract.
Yes, you do.
But why do we have? That's not breaking a contract. If I had to give them 120 days after the contract.
Jimmy made a great point. There was a board that said, "Hey, your contract ended June 30th. I'm just not giving you a new contract."
Right.
Well, and they won, and you have to give them 120 days after June 30th.
So they're automatically telling you have to.
It's almost like a evergreen, unless you give them 120 days. It's almost like it's evergreen, ongoing, unless you give them 120 days. That is correct.
But you're not breaking a contract.
Correct, I know. Jim is right. We are not breaking contract, but the Ohio Revised Code provision is telling us that we still have to give them 120 days.
Makes no sense.
It doesn't make
So-
a lot of sense. Yeah. Yes, Linda.
So I was thinking along the same lines as Jimmy. I guess I don't quite understand. I mean, I understand that they want to protect
Client.
the agencies and everything, but by the same token, if you have a contract that has an end date, what do we do to protect ourselves? Do we, like you said, the 1st of March, we contact everyone and say, just a reminder, your current contract expires on June 30th? I mean,
Would that be
do we just do a blanket, your contract is up
And
kind
you
of
know
thing?
you know what, Selena, that's what we did to kind of cover us
Yeah.
liability, correct? So we're already doing that. Everybody gets 120 day. But now even this was challenged, saying your 120 day wasn't specific enough, so I don't have anything to appeal. You gotta make it specific enough so I can appeal it. So just saying that, hey, I don't know if I'm gonna get state funding at the same level as today, it was ruled, or at least the opinion of attorneys is not specific enough. So I'll give you another example. Let's say we contract with agency ABC for housing services, and we are unhappy with them. Even if this is June 29, and we know we have only one more day of contract, and tonight we have a board meeting, really to really cover our butt is we give them a 4-month contract, and with the new contract we give them 120 day. So we allow 4 more months for them to transition the clients, to work with us, maybe to transfer the clients to a different provider. But that's really the only safe way for us to avoid litigation.
Can't do it for a breach.
Breach, there is breach, but you have to have, there are 4 or 5 examples, such as fraud, financial fraud, if you can identify it, such as losing your license. So it has to be pretty black and white and clear, the breach of contract, for you to be able to act on it. And I will tell you, it's pretty hard to prove fraud by us. The best we can do is report to the AG office.
Non-compliance of service.
And sometimes AG office investigations could take up to 2-3 years, and you still might not hear from them. So you way safer to give them 120 days and you are done in 4 months, than wait for AG to investigate and you might never hear from them, which will happen.
I'm sorry, I guess, and I know this is complicated, but I guess I don't quite understand. If you have a contract, the contract pretty much lays out the terms. So I guess I don't understand. If you include in there something that says, per the Ohio Revised Code, you have to have 128 days notice to cancel. I guess I don't understand where there's room in that for litigation. It seems like we've covered, right?
Well, we are covered because we automatically give them 120 days, as I said, every March 1st.
Okay.
But as I said, the only challenge is some of the providers across the state, not our providers, challenge others in courts that the 120 day wasn't specific enough. Like, you gotta tell me what major change, what is the major change that you are terminating my contract or not planning to give me a new contract?
So why do you have a board then? If they're
Well,
going to make a decision.
That's another.
I mean, they're making a
Yeah.
decision for the board then.
I mean, we were concerned, some of the boards, that providers might want a standard contract across the entire state of Ohio, which obviously is not going to happen because Ohio is a home rule state. And I'll tell you, some providers disagree with some other providers. So, you know, we don't have our main provider is Farlands, and Oriana was our main 2 providers. We don't have any disagreements regarding the way we interpret the law, but it doesn't mean that we won with others. Again, it doesn't seem that we have this issue in our board district. But I just wanted to bring this to your attention. If we end up to some best practices of interpreting this law, I'll definitely share it with you guys. but we are just not agreeing among boards and providers to put anything in writing. And I think the reason nobody wants to put anything in writing is because there are still litigations happening out there. So we don't want anything that we put in writing, as everything we do is public record, to be used in a litigation process. So we are trying to, again, understand how exactly this 120-day notice should operate. As of now, as many years before, we gave 120-day to everybody, just so you guys know. I'm not sure if this is what Board of DD has to do as well or not, but I know for sure we do. Hey, Dean, did you want to say something? Anybody else? I'm sorry we lost, I believe, 2 members. I was a little too long tonight. Any other questions? We got into the dry stuff at the end. I apologize. Okay. Happy Thanksgiving, all of you. See you guys December 3rd. If you need any additional information about what we talked tonight, any questions, please contact us. Happy Thanksgiving.
Happy Thanksgiving, everyone.
Same to you. Thank you.
Happy Thanksgiving.
5:57 p.m. I'll stop the recording. Reminder for the first 2 items I'll have to give you in writing.
Okay.